Welcome to Albany. I think we were here last year talking to you about eating disorder, and I know it's a real problem. I know it does exist. It's something I think we need to focus more on because a lot of people are unaware. They don't understand the large number, mainly among females, and we're working hard to do whatever we can to make life easier for you, to make you understand that you have a lot of support and whatever we can do. And I know with Peter, him and I have talked about this many, many times. It's kind of been quiet in the background with a number of other people. But as I move around my district, I talk about it. And I have run into a lot of mainly young women who are suffering from it. And I explain to them some of the things they need to be doing. And I talk to them and try to focus on other things other than. And I think one day we will be very successful at this. And we need all of you to help us and to remind us that this problem exists and to tell other people so they will know. It's not a secret. It should be like everything else. It should be out there. People should know about it. People should be supportive. And I just want you to know that I am here to support you, and I will continue to do that. My office is at 508. If any of you need to speak to me or to talk about any issues, I am available. So again, I thank you for coming. God bless all of you.
Senator, thank you very much. And Senator, I have to tell you that I became aware of eating disorders a few years ago. I don't want to tell you how long.
Okay.
But it was when Karen Carpenter died, and that was 20, 30 years ago.
Yes.
However, I was not aware that there was such a thing as an eating disorder before that. And I think that her illness and her death really highlighted to many, many Americans. The sad part of it is that we're told of these stories every 5, every 10 years, every year or so, and then we put it in the back of our head and we really forget about it until the next tragedy, until the next story comes up, until the next issue of bulimia or the other illnesses that are eating disorders do come up. What our bill does, as you well know, Senator, and for the public to be concerned about, is it doesn't cost the state, it doesn't cost the public anything. It's a training program. It's really provides online training to doctors and physician's assistants so that they become aware of it, so that they're able to analyze it, so they're able to do something in a very clear, in a very easy, and in a very concrete way. And I know that your house passed it last year.
Right.
What we have to make sure is that both houses pass it this year and that it becomes a high priority. It's the right thing to do with this year's budget. It's the right issue to highlight in our communities. As everybody knows, this is a mental health issue. It may not be perceived as a mental health issue, but it is a mental health issue. And whenever we can focus on mental health issues and say that we all suffer from one manner or another that can be tied to mental health, then I think we have a cleaner, a healthier, and a saner nation when we do that. So I want to thank you, Senator, and I want to thank the public for being here and for sharing some of their stories. Lynn, will you come back here and explain some of the stories that are here?
I'd be happy to. Just to be on the record, we know that 24 million people in America suffer from eating disorders. It's been on the increase over a 5-year period. It increased by 18%, the hospitalizations, and among males, we have a 37% increase. So just a couple statistics there for you. First, I'd like to invite Maria up just for briefly, just to say a few words about why this bill is important to you.
Hi, my name is Maria Belofsky. I've been in recovery now for about 2 years from an eating disorder, and for quite a while in my life, my mental health was in turmoil, my body was in turmoil, and I'm still now suffering from long-term side effects from the eating disorder. And it's my hope to try to educate other physicians out there that if this is caught soon enough, people wouldn't have to have heart murmurs that last their entire life. They wouldn't have to have stomach ulcers. They wouldn't have to have all the problems that are associated with eating disorders that won't go away. And if we can get more awareness out there, we could save lives. So.
Thank you.
Thank you. Next, I'd like to introduce you to Nicole and Daniel Llewellyn, the husband and wife team, supportive husband, but I'll let them briefly tell you their story and why this bill matters to them.
Hi, I'm Nicole, and this is my husband, Dan. When you think of anorexia and bulimia, you think of a haggard skeletal appearance or, decaying teeth or scars on your knuckles, but how did they get there? It took a long process for them to get there, and if we can catch this early enough, you can prevent that. You could probably save a life. But there's probably someone better, someone that's probably better qualified to tell you about eating disorders than I am, even though I suffered for 26 years. My friend Hannah passed away this past January. She was 19 years old, and she suffered from an eating disorder. Probably if we caught it earlier, she might still be here today. She was on fire for recovery, but now she can't tell you that. Only I can show you her picture and let you know that this beautiful young lady suffered, and she can't speak today because of it. So if we pass this bill, we can teach physicians to ask the right questions, teach them to ask the right questions to tell the parents, because parents rely on them to tell them, yes, your daughter is suffering. Yes, look for signs other than just obvious weight loss. Help the children out there before it's too late.
My wife has suffered from eating disorder for many years. Sorry, she got me going. And the thought that if 26 years ago a doctor had said something to her parents, that she wouldn't have had to go through all that our children wouldn't have to see that. This bill's very important, and it doesn't cost a thing but an hour of a physician's time. Thank you.
Thank you.
Diane, do you want to come up for a minute? Just say a few words? Just a few words, that's okay.
Okay. My name is Diane Buttram, and I am in recovery for an eating disorder. And I am unlike, I would say, some stereotypical eating disorder person would look like. I started with an eating disorder in my early 40s after some life-changing incidences where I was in an accident and I was out of work and I was very depressed, and I started an eating disorder, and as a way to cope with my depression and my change in lifestyle, the help that I was so desperate, I have to say I'm also a breast cancer survivor, and I thank God for my oncologist, because I was able to open up to her and tell her what was going on, and she's the one that told my primary care physician about what was going on with the eating disorder, and I ended up seeing a psychologist, but I have to tell you that my access to the healthcare system was very limited. Insurance companies did not believe that I had an eating disorder because I was depressed or because of my accident, and that incident there, I ended up going inpatient to a facility in Philadelphia in 2003. Around Christmas time, I left my two children, Ashley and Matthew, and my husband and my family. And I remember calling them on Christmas Eve when we all get together, my whole family, and they're there together, and we're all crying over the phone because Mommy's not there with them. And I just think it's really important. If the doctor had asked me, or if my physician had caught it sooner, maybe I wouldn't have suffered as long as I have right now. And I do believe that prevention and education and stereotyping, it's not only young girls, it's men, it's women. it's boys and girls. And I've seen a lot of men who suffer. They don't say it because they are embarrassed because this is a woman's disease, quote unquote. So to really know the figures on how many people are suffering out there, I don't think anybody could really give you a percentage. But I can tell you there's a lot more out there and a lot more people that can be helped if the right questions are asked through their primary care physician.
Thank you.
Helen, could you come up real fast? Thanks. You okay? Okay. All right, just real quick.
Hi, good afternoon. My name is Helen Troncoso, and I'm Miss New York Belleza Latina 2011. And I'm here because as a Latina woman, as a woman of color, to support this bill so that doctors and physician assistants are educated in recognizing the signs and symptoms of an eating disorder. Eating disorder does not know any kind of color, any race. It affects everyone. However, especially in our cultures, in our communities, there is such a stigma attached, which is why we need this bill. We need to keep increasing awareness so that we keep educating people so that we can stop this disorder from spiraling out of control so that no other woman has to become a statistic. Thank you.